Ken Landau. Thanks for watching. Let's talk about Bystolic, or Nebivolol. This is a drug in the beta blocker family used to treat high blood pressure. Was given marketing approval by the Food and Drug Administration in 2007 and has been available since 2008. Seems to be safe and effective and well tolerated for people with mild to moderate hypertension. So hypertension or high blood pressure, very common condition. It's estimated in the United States that somewhere between 50 million and 70 million people have blood pressure that's too high. They fall into the hypertensive category. That's 1 in 3 among people over age 20. And yes, if you're 20 or 30 or 40, you can get hypertension. And in addition to this 1/3 of the population, we have another 1/4 of the population that has blood pressure that's above normal but not high enough to diagnose hypertension. Talking about a major number of people. That's in the world over 1 billion. And if you have high blood pressure and you don't do anything about it, it's going to increase your risk for developing a heart attack, heart failure, stroke, kidney disease, dementia, problem with your vision. We know if you lower the blood pressure, then you reduce your risk of a stroke most consistently, and you also reduce the chance of having a heart attack or heart failure. So obviously, good reason to reduce the blood pressure. The people who are most at risk are obviously the people who have the highest blood pressure, but also if you have moderately high blood pressure and you have some other risk factor to boot, then you're really at high risk. So for instance, if you have high blood pressure and you also happen to have elevated cholesterol, maybe you have diabetes, well then you're at a special risk for all of the complications of hypertension. Now what's normal blood pressure? Normal blood pressure is less than 120 over less than 80, the systolic over the diastolic. Less than 120 over less than 80. You're borderline, so you're sort of in that in-between zone, the 25% zone, when you have a systolic blood pressure of 120 to 140 and a diastolic between 90 and 100, then you have stage 1 hypertension when your systolic reading is between 140 and 160 and your diastolic reading is between 90 and 100. And stage 2 hypertension is when the upper number is more than 160 and the lower number is more than 100. Well, what's first choice for therapy? I tell you what, first choice for therapy, if you're borderline or above, is you should pay attention to some lifestyle changes. Certainly in the United States, 2/3 of us are overweight. That increases your risk of high blood pressure, so you should try to reduce your weight. You should restrict the amount of salt that you consume. A lot of people say they don't use any salt. Well, be that as it may, there's a lot of salt in your food. If you go to a Chinese restaurant, what do you think soy sauce is? It's basically pure salt. Well, how about looking at the sodium content of the food when you go to the grocery store? Before you buy something, look and see how much sodium is in there. I eat out fairly frequently. I check the food. One of my favorite restaurants, a salad has 2,600 milligrams of sodium. The recommended allowance for an adult over age 40 or 50 is only 1,500 milligrams a day for the entire day. And here the salad, one salad, has more than that, has almost 2 days' worth. So restrict your sodium. Consume more fruit and vegetables. If you're a cigarette smoker, you're trying to commit suicide. What the hell are you doing? Get off of the cigarettes. That's not a good habit. It also increases your blood pressure. And if you drink more than a moderate amount of alcohol, that also pushes your blood pressure up. So don't do that. Cut down. 2 drinks max if you're a man, 1 if you're a woman. And if you happen to be taking a non-steroidal anti-inflammatory drug in the aspirin family, ibuprofen, Motrin, naproxen, those kind of drugs, they can increase your blood pressure. When those lifestyle modifications don't work, or unfortunately if you can't follow them, then you'll need some kind of drug therapy. The first choice in drug therapy is a thiazide diuretic. That would be a water pill. Second choice could be an angiotensin-converting enzyme inhibitor, a drug like lisinopril, very commonly used, or a relative known as an angiotensin blocker, medicine like Diovan, calcium blocker like Norvasc, or the beta blockers. Now, the beta blockers seem to be especially beneficial for those people who are at high risk of having a heart attack or heart failure or coronary artery disease or maybe even diabetes, because they decrease the stress of the heart. They decrease the output of the heart. They decrease the rate of the heartbeat. They seem to decrease the amount of adrenaline or noradrenaline floating around the system. And they also decrease the amount of renin, that's a chemical that the kidney makes that tends to push up the blood pressure. Now, supposedly, Bistolic also has a novel vasodilating factor, that's made by the cells that line the blood vessels. We call those the endothelial cells, and they can make nitric oxide. Nitric oxide is supposed to be especially beneficial in this particular drug. On the other hand, it probably isn't, and probably better choices if you were going to take a beta blocker for that, for vasodilating purposes, would be taking Corig or maybe labetalol, but back to that in a minute. So the beta blockers can either be selective and focus their attention on just the heart, or non-selective and affect the heart, but then a variety of other organs. For instance, they can affect the bladder, and they can affect the gastrointestinal system, and they can affect the lungs. Well, supposedly, Bistolic is the most cardiac selective of all of the beta blockers. But it's not really, because it varies with the dose, varies with the age, it varies with your genetics, it varies with the amount of peripheral fat you have, and it also has to do with the dose. So if you're taking 5 milligrams or less, and that's not terribly effective for the blood pressure, well, then it might be fairly cardioselective. On the other hand, if you're taking a little bit more, then it's not cardioselective anymore. And a lot of people are taking drugs that prevent the metabolism of Bistolic, so you get a higher level. And if you get a higher level in the system, then obviously that low dose isn't such a low dose anymore. So the people who are taking amiodarone for atrial fibrillation are people who have depression and are taking Wellbutrin or bupropion. People who are taking Prozac or Paxil or Lexapro. Those people are going to have, in effect, a higher level in the system. People who are taking Celebrex, drinking alcohol. People who are depressed and taking a major antidepressant or atypical antipsychotic like Haldol, they're going to have an increased level. And also, we find an increased level in the African American population. Now, how effective is the drug to treat hypertension? It's okay. It's no better than any of the other drugs. It seems that it can reduce the upper level, the systolic level, by about 7, 8, or 9 millimeters of mercury, and about the same on the bottom level. Might not work as well in African Americans as it does in Caucasians. It can be used either by itself, or it can be used as an add-on drug. And people who need it as an add-on drug might not work quite as well, might only reduce the upper number by about 6 and the bottom number by about 7. Has some side effects, just like anything else would have a side effect. But the side effects aren't all that different from placebo. So if you ask enough people, some people are going to complain of dizziness or headache or nausea or fatigue or insomnia or chest pain or shortness of breath. But most appropriately, or more importantly, people who are really cutting down on their salt, they might find that they get a little lightheaded. And some beta blockers tend to cause some cold hands and cold feet. Some of them decrease the sex drive. Some of them can cause erectile dysfunction or impotence. And some of them can cause a mild degree of depression. And because of those reasons, about 1 in 5 to 1 in 10 people who begin therapy are going to stop just because they don't like the side effects. Now, you have to have a certain amount of caution. If you have Raynaud's disease where your fingers turn white or your toes turn white if you get too cold. People who have peripheral vascular disease or diabetes or asthma or hay fever or kidney disease might have to be a little careful of this particular drug, and it's okay to take it if you have mild heart failure, class 1, class 2, but if you have more severe, class 3 or 4, If you have a very slow heart rate, no, not a good idea, because this drug slows your heart rate. If you have more than first-degree arteriovenous block, a problem with the electrical impulse going from the top part of your heart to the bottom part of your heart, again, not for you. If you already have more severe level of heart failure, 3 or 4 grade, you shouldn't take it. Or if you have sick sinus syndrome and you don't have a pacemaker, not for you. Severe kidney disease, liver disease, nope, not for you. If you have bronchospastic disease, asthma, nope, not for you. And interestingly, it can block the symptoms of hypoglycemia, so your blood pressure can fall, and you don't know it, and you don't have the symptoms of the agitation, the anxiety, the palpitations. So that's risky. And if you happen to have hyperthyroidism and take it, and then you stop, you might have thyroid storm. So that could be extremely bad. It's not really researched very well in people who've had recent heart attack. Seems that certainly anesthetics, not good to mix with this drug, and don't take it if you're taking another blood pressure medicine known as aliskiren. If you decide you want to stop the drug and you've been taking it for a while, you do have to be careful. You have to taper off of it over a couple weeks. If you stop it acutely, you might exacerbate angina if you happen to have that, or have some ventricular arrhythmias, or even have a heart attack. Well, it slows the heart rate, especially if you have other medicines on board at the same time. So if you happen to be taking a calcium blocker like verapamil or cardizem, or you're taking some other antiarrhythmics, that's not a good combination. If you happen to be pregnant, we know that it can cause potential problems to the unborn. It can cause prolonged gestation and dystocia, problems with the delivery. And in animal studies, it was associated with an increased incidence of fetal death. It's found in the breast milk. And certainly, you don't want to combine it with another beta blocker if you happen to be taking one. Well, if you decide you want to take this drug, you start off with a low dose. You start off with 5 milligrams once a day. You do that for about 2 weeks. And then you slowly increase the medicine up to a maximum of 40 milligrams a day, until you can find a level that's beneficial for you. Now, if you happen to have kidney disease or renal disease, or you happen to have liver disease, you cut down and you only take about half as much. You start off with 2.5 milligrams. Now, the drug hasn't been entirely free of problems. In 2008, the Food and Drug Administration slapped the company's hand. It was Forest Pharmaceuticals at that time. And they slapped their hands because they were advertising to doctors. They were taking out these big ads that said how great the drug was, how novel it was, how it worked so great in people who had diabetes, or people who were obese, or people who had poor metabolism. And supposedly it was better tolerated and had this vasodilator quality to it that I mentioned a moment ago. And supposedly it was effective in a wide range of people, including African Americans. And the Food and Drug Administration said, hey, stop that nonsense. That doesn't really happen. Well, beta blockers, all in general, can reduce the likelihood of having a heart attack by 10, 15, maybe 20%. But beta blockers overall seem to be less effective than maybe the diuretics or the ACE inhibitors, drugs like lisinopril, in preventing a heart attack, preventing a stroke, preventing some kind of cardiovascular event. And there has been no study that really showed that Bystolic reduced the likelihood, specifically Bystolic, not just all the other beta blockers, but Bystolic itself. Studies have not been available to show that they can reduce the likelihood of your having a cardiac event or dying. Now, in spite of that, the drug company wanted the Food and Drug Administration to give it approval to put on its label, to market it for being good in patients who have congestive heart failure. Well, the Food and Drug Administration kind of looked and said, what are you talking about? The advisory committee said, we don't see any evidence that there's a benefit as far as mortality is concerned, or a benefit as far as cardiovascular hospitalizations for congestive heart failure is concerned. And then the company had another embarrassing event in 2014, both in June and again in November. It had to withdraw or recall about 94,000 cartons of medicine that it sent to doctors' offices because of poor quality control and problems with the medicine dissolving. Now, is the drug any good? Dr. Eric Topol, who used to be the chair of cardiology at the Cleveland Clinic and now the chief academic officer at Scripps, he says that he doesn't see any reason for anybody to use the medicine. He doesn't prescribe the medicine. He doesn't think it has any special added benefit to the medicine. And Public Citizen puts it on its worst pills list. Beta blockers in general are okay. Sales went from about $1.3 billion in 2002 to $2.3 billion in 2016. But just remember, that's the entire class. There are 15 different drugs in the beta blocker family and lots of generics to boot. And all of them together sell about $2.3 billion. Lantus, one type of insulin, sales last year were almost $7 billion. Well, beta blockers might be the first choice if you have high blood pressure and you also have angina, coronary artery disease, maybe you had a heart attack, maybe you had congestive heart failure, you have an arrhythmia, maybe atrial fibrillation or migraine headache. But the best options would probably be some of the cheaper drugs. Maybe you take atenolol, which is a beta blocker, or metoprolol. Maybe you take a drug called Coroguard, or you take propranolol. There's no evidence that any of these really are any better than any of the others. But we know the cost for beta blockers can range per month from less than $10 to more than $200. Now again, there are about 15 of these different beta blockers on the market, and they're all basically effective. And it's really hard to find any one that performs better than any other for the overwhelming majority of people. Now, if you want Bystolic specifically, if you want to pay cash for it, it's about $5 a day. So a month's supply is about $150 cash. If you have a coupon, it might be $120, $4 a day, in other words. But the company comes out with a cash copay card so that if you go and purchase the drug, they'll limit the amount that you have to pay because they want to sock it to the insurance company. They don't really care about you. The amount of money that you're going to pay isn't really going to their coffers to boost them nearly as much as the amount that they get from your insurance company. So $5 a day for Bystolic, but you could take an entire month of Lopressor or Tenormin or Coreg or Toprolol. You could take an entire month for about $10 of those drugs. And interestingly, the Bystolic is what we call a racemic mixture. So it's a mirror image. There are two molecules in there. One of them is what we call the right-handed, and the other is the left-handed. Well, one of them is totally inactive, so I'll tell you what's going to happen. When the patent expires, they're going to come out with a new and improved version, and they're going to get rid of the inactive ingredient. And they're going to say this is new and improved, but it's basically the same old thing. So the bottom line is, for $5 a day, is Bystolic any better than less than $2 a week for one of the other beta blockers? And the answer is, I don't see anything. Dr. Eric Topol doesn't see anything. Public Citizen doesn't see anything. Seems like there's an awful lot of hype around the subject. So if you're interested in taking a beta blocker, there are lots of them available. And you could probably do better than Bystolic. Thanks for watching. I'm Dr. Ken Landau.